So when a woman presents with symptoms, you have to try and decide what do the symptoms indicate as the possible diagnosis. So typically in endometriosis, a woman will present complaining of painful periods, pain with their bowels, pain passing urine, pain during sexual relations, or fertility issues. So this will give you a clue of what might be going on. You then examine the woman and you do an abdominal examination to feel for any masses in the tummy. And if somebody has already had sexual relations, you might do an internal examination to look for a womb that isn't very mobile or any nodules of endometriosis, which would give you a better clue about what's going on. Following this, you then arrange to have appropriate investigations, and either an ultrasound scan, which should be an internal scan, or if that's not possible, an MRI, or an MRI in any case, may be of benefit in making the diagnosis. The scan or the MRI should be carried out by somebody who is expert in performing the procedures and reporting the procedures. So if you have a good history, a good examination, and appropriate investigations, you can have a good idea of what's going on. Both expert vaginal ultrasound scan and MRI can make a positive diagnosis, but it doesn't necessarily exclude the diagnosis of endometriosis. The only way you can be 100% sure or not is to do a laparoscopy, which is a look inside the abdomen to see what's going on. And a laparoscopy can't be wrong because your eye is inside the tummy. But unfortunately, a laparoscopy is an operation, and all operations have risks and benefits. So you have to determine with the woman whether a laparoscopy is justified in making the diagnosis. But more commonly nowadays, a laparoscopy is not really used as a diagnostic tool, it's used as a therapeutic tool to treat the condition that you already know about, having taken a good history, examined the woman, and also carried out appropriate investigations. When asking about can symptoms be confused with other conditions, of course, all the pelvic organs are close by. So some women can have functional bowel disorders, which can cause pain opening the bowels. And the bowel is sensitive to the hormonal cycle. So the bowel pain may coincide with the periods, thinking that it's related to endometriosis, when indeed it's a functional bowel disorder. The same thing can occur with painful bladder syndrome. People can have pain on intercourse due to other reasons. So it's not always easy to make a diagnosis. And the other problem with pain is if somebody has pain, then there's a phenomenon of learnt pain. So once you have pain, it's very hard to unlearn pain. And then if you get pain in one area, it can cause pain in another area. So sometimes the conditions can be fused with both colorectal conditions and urogynecological conditions, and therefore it's not always clear what's going on before appropriate investigations, and in some cases, a laparoscopy. Well, a definitive diagnosis of endometriosis in the pelvis is always made on laparoscopy, because a laparoscopy, the telescoping is inside the pelvis, you can see what's going on, and you can make the diagnosis. Hopefully it's supported by histology, as in taking away a small piece that's sent to the lab, but histology can be negative, and it depends how hard the pathologist looks for the cells signifying endometriosis. But the definitive diagnosis and the gold standard is laparoscopy. There can be implications of having a diagnosis of endometriosis. On the one hand, it's always good to have a label for something that's causing the pain, because it helps the woman address the issues and work out a future way to move forward. It can have a negative impact on fertility. Some women can occasionally have very severe endometriosis and have no symptoms and no fertility issues. And some women can have milder endometriosis and have significant pain or fertility issues. On the whole, the worse the endometriosis, the worse the symptoms, but it's not a direct correlation as in a straight line. The implications of having significant severe endometriosis fertility are quite great, and it's sometimes very helpful to make the diagnosis because it allows a couple to move forward and perhaps consider IVF if that is more appropriate. With regards to the treatment for endometriosis, there are relative indications and absolute indications. With regards to fertility, it may require treatment if a woman wishes to fall pregnant, but if she doesn't, then there isn't the necessity to have treatment. If the symptoms aren't severe and they are managed easily with simple analgesia or with hormone manipulation, then yet again, surgery is not required. However, where it has very severe endometriosis causing obstruction of the ureters that drain from the kidney to the bladder, or causing bowel obstruction or a large abdominal mass, then the indications for surgery are absolute. But this extreme group of women is quite rare, and on the whole, treatment, particularly surgical treatment, is a relative indication depending on the symptoms that the woman is experiencing. Currently, there is no cure, and the person who determines the cure will probably get the Nobel Prize. However, we can manage symptoms to allow women to have a satisfactory reproductive life. So the aims of treatment is to initially allow a woman to complete her family before considering more definitive treatment. The days of recommending a hysterectomy in a woman who is young, who hasn't completed her family, is incredibly rare nowadays, whereas this used to be a thing of the past. So hopefully, with medical treatment and appropriate surgical treatment, we can moderate symptoms to allow women to at least complete her reproductive life and even hopefully get her to the menopause when endometriosis would be less of an issue.